What is the role of electrical current in bipolar TMS therapy? Imagine a tiny spark traveling through a wire to wake up a sleeping circuit. That's similar to what happens in bipolar transcranial magnetic stimulation therapy. In this treatment, the electrical current is the key player that directly influences brain activity. When a clinician uses TMS, they place a coil on the scalp over specific brain areas involved in mood control, like the prefrontal cortex. The device then sends a brief, powerful electrical current through this coil. This current creates a magnetic field that passes through the skull and into the brain tissue beneath the coil. According to the principles of electromagnetism, changing magnetic fields can induce electric currents in nearby conductive materials, like brain tissue. So, the magnetic field generated by the coil causes neurons in the targeted area to experience an electric field. This induced electric field causes neurons to depolarize, which means they become more likely to fire or activate. This process is essential because it can either excite or inhibit neural activity depending on the stimulation parameters used. The electrical current in TMS is very brief but intense, usually lasting less than a second per pulse. It is generated by a stimulator device that controls the magnitude and timing of the current. The strength of this current is carefully calibrated to ensure effective stimulation without causing discomfort or adverse effects. When neurons are depolarized, they can change their firing patterns, which may promote neuroplasticity, the brain's ability to reorganize itself by forming new connections. This is especially important in managing bipolar disorder, where mood regulation circuits often function abnormally. This induced electric current primarily affects superficial brain regions up to about 5 centimeters deep. Because the stimulation is localized and non-invasive, it targets specific areas involved in mood regulation without affecting the entire brain. Unlike treatments like electroconvulsive therapy, which deliver direct electrical currents through the scalp and requiring anesthesia, TMS uses magnetic fields to induce currents indirectly. This makes TMS safer and more precise. In managing bipolar disorder, the goal of this electrical stimulation is to help rebalance abnormal neural activity that contributes to mood swings, depression, or mania. Although TMS is more commonly approved for depression, research is ongoing to explore its benefits for bipolar disorder, especially during depressive episodes. The electrical current's ability to modulate neural circuits helps improve symptoms by encouraging healthier brain activity patterns and supporting neurotransmitter systems like serotonin, which often become dysregulated in bipolar disorder. To sum up, the electrical current in bipolar TMS therapy is the fundamental physical force that stimulates neurons in specific brain regions. It triggers changes in neural activity, promotes neuroplasticity, and influences neurotransmitter releases, all of which can help reduce mood symptoms. This current is generated outside the body through magnetic pulses, making TMS a safe, targeted, and non-invasive way to support mental health. Always remember, anyone considering TMS should consult a healthcare professional to determine if it's suitable for their individual needs.